Thanks so much for joining us here today with the ARC of Northern Virginia as we talk about Medicaid and Medicare dual eligibles. And this is a population where the overwhelming majority of folks with developmental disabilities will end up at some point in their life where they're navigating benefits for both programs. We are really pleased here to be joined by Lisa Humes, who's a licensed insurance agent at Health Markets. Her healthcare expertise spans more than 30 years of working and living in Northern Virginia. And she represents Health Market Insurance Agency all throughout the metro areas, focused on serving the life, health, retirement, and long-term care needs of families, individuals, and small businesses. So all that is to say, she has some really amazing knowledge and expertise that's very hard to find, and she's got a lot of it. So we will turn things over to her. And as a reminder, if you're joining us live, you can put your question in the Q&A at any time. So Lisa, please take it away.
Thank you so much, Lucy. I appreciate being here today, and thank you everyone for logging on to the webinar. Hopefully you'll get some questions answered. And I don't profess to know absolutely everything, but I will do my best to answer any questions that you have, as well as research anything if need be afterwards. So as Lucy said, I am an independent insurance agent. My name is Lisa Humes. I can help folks create benefit packages and do a variety of different kinds, or serve a variety of different markets, whether that's an individual, somebody in Medicare and Medicaid, or a business with their employee benefits. So today I'd like to cover some highlights about Medicare and how it layers on when you add Medicaid to the mix, as well as the Extra Help or LIS program, and then also what extra benefits you might be eligible for, called dual eligible special needs plans or DSNP plans. So there are a variety of different things, and it's kind of like a layering effect where you add one benefit kind of right on top of the other. So what I'd like to start with is a little bit about what's included in Medicare and go through that discussion. Some folks that I've worked with on the disability spectrum are only eligible for original Medicare. And if that be the case, we're going to start out with that. And then we'll add in the Medicaid, talk about the LIS, and then end up with the dual special needs plan. So we have a little bit of an idea of the range of what people can get. I'm going to go ahead and share my screen, and I've got two different slide decks. The first one is just about Medicare. So whether you are under 65 disabled and been on Social Security disability for 24 months and just coming into Medicare, or if you're over 65, there are also some other folks that have special chronic needs or critical needs that may become eligible for Medicare earlier than that 24-month window as well. So if you're in Medicare and only Medicare, let's talk about what you have as an option. This gives us an example of a Medicare card with the Part A and the Part B. So typically, that one, Medicare Part A, these two are the government-sponsored programs. Part A covers the hospitalization, skilled nursing, and hospice care. The Part B is to help cover for things like doctor visits, lab, x-ray, physical therapy, and durable medical equipment. Some medications, Part B medications like chemotherapy and immunotherapy, are also covered under Part B. Part A and B, however, do not cover prescriptions, so we're going to address how do we get those separately. But under these two government-sponsored programs, what is included? I talked about the services that are typically included, but what about the cost? So for Part A, does it cost you anything? Typically, that one comes at no charge, as long as you have worked your 40 quarters or 10 years full-time. Or one of your family members may have that also made you eligible for that. So typically, Medicare is a zero cost. Part A comes to you at zero cost. Now, some folks who maybe didn't put in their 40 quarters or have only been here in the US for 5 years and haven't worked, they can purchase Part A. So it can be either zero cost or all the way up to $499. Part B is the one that everybody generally pays for. And the base rate in 2022 is $170.10. So $170.10. Now, there's a couple of places where Medicare can charge additional amounts for not only Part B, but for prescription coverage as well, they can tack on some additional coverage or some additional cost. And if you did not enroll in Medicare when you were first eligible, whether that's under 65 disabled and they sent you your Medicare card, but you deferred it, or if you just turned 65 but continued to work or didn't want to enroll, there can be what's called late enrollment penalties. If you've had a lapse in coverage, either with medical or prescription coverage of more than 60 days, and you were eligible for Medicare, then when you come back to re-enroll, there could be some late enrollment penalties. If you have any questions about that, I'm happy to answer them, but that's just one way that you can get some additional cost tacked on. The second way is if they consider you a high wage income earner. So if you're considered a high wage income earner, as an individual, it's $91,000 or more. If you're a couple, the household income of $182,000 or more, and they do a 2-year look back. So maybe you had a higher income a couple of years ago, but they're still charging you that additional cost, which is called an income-related monthly adjusted amount, IRMAA, or IRMA charge. If you're getting charged that, there is a way to appeal it, just like the late enrollment penalty, if you actually had coverage and you can prove that through one of their forms, then some of these costs can be taken away or reduced. So again, if you have specific questions, happy to help them with those. Now, with Original Medicare, there's a fair amount of holes. So they don't cover 100% of the cost, even though A and B help to cover for your medical costs and your hospitalization. When you go into the hospital, if all you have is Original Medicare, you have a deductible, $1,555 each time you go into the hospital, and that's the first day. If you're in for an extended stay, there may be co-insurance and co-pays later on, so it can get a bit pricey. Under Part B, the coverage there's a yearly deductible. This year is $233, and then typically Medicare picks up 80%. Now, that leaves you with 20%, but it's 20% to infinity because there is no cap or limit on what comes from your pocket when you have Medicare. With a regular health insurance plan, typically they have a maximum out of pocket or a cap on what you would pay. With Original Medicare, there is no cap. So that's why it's important to look at some of these extra ways to help get that coverage. And again, this is only if you have Original Medicare and none of the extra government-sponsored programs. So you might be eligible for a Medicare Supplement. It's also called a Medigap or a secondary insurance. Now, usually these are for folks who are 65 and over. There's one Medicare Supplement available in the state of Virginia for those that are under 65. It's generally pretty pricey, and it's not full coverage by any stretch of the imagination. So it rarely works out to be to anyone's advantage. There are some very specific folks that might benefit from that program, but typically over 65 folks are the ones you find that need Medicare Supplement or want it. And because the Medicare Supplement or secondary insurance backs up Original Medicare, Part A and B, then that means that you have to get your prescriptions elsewhere because the supplement doesn't cover them either. Now, that's a good thing because then you can mix and match and you can make it work for whatever your needs are. The Medicare supplements, again, they just back up Original Medicare, which means that Original Medicare is your network. Going to a new provider, doctor, or hospital, you would only ask if they participate with Medicare. If they do, then you're in. No need to tell them about your supplement plan. Except when you get there to give them your card so they make sure they run it through there, run the claim through there so they can pay the bill. But you don't have to worry about it for a network. Now, this is a higher cost of monthly premium, but lesser cost when you go to the doctor or to the hospital. So it's kind of like you're prepaying for the care. The other option is with Medicare Advantage. Medicare Advantage is with private insurance companies only, and they are offered in Northern Virginia through companies like Aetna, Anthem, Humana, United Healthcare, Kaiser. Those are the 5 options that you have here. And they are, again, one card takes care of everything. They take over the benefits for Medicare, hospitalization, and doctor visits. They also add in prescription drug coverage on most plans, and they can add some additional plans or benefits like dental, vision, hearing, over-the-counter benefits, maybe a free gym membership. So they give you some extra things. Typically, Medicare Advantage plans have a low monthly premium, but there's some sort of copay or cost for each service that you receive. So you are paying as you go for your services. Under Medicare Advantage, you still have to maintain your Medicare Part A and Part B. You will still be paying your Part B premium, because Medicare takes that money and they turn around and subsidize these Advantage plan companies to help them run the plan and do the claims. Since they're paying them or subsidizing the company, they back out, and then all your claims run through Medicare Advantage, meaning that your network now becomes that company and its network of coverage. To stay inside the network is extremely important, so you get the lower cost and copays. If you go outside the network, you may get the entire bill. So it's important to stay inside the network. Even with a PPO plan, when you go outside the network, you might have a deductible first and then a higher cost for your coverage. So it's to your benefit, if you can, to stay in the network. There are, let's see, checking all my notes here. The other thing I wanted to mention is about cost. Medicare Advantage, I already said, is generally a lower cost per month. Pay as you go. Medicare Supplements, higher cost, but less cost when you go to the doctor or the hospital. On the Medicare Supplements, they do get more expensive each and every year. As you have a birthday, they go up in cost. So at 65, it might be one cost. At 80 or 85, it's going to be something totally different. It goes up each and every year. They are also not guaranteed. If you don't come into a Medicare supplement when you're first eligible, then you've got 6-month window generally to be able to get into one of these plans. If you do not and want to start one later, you may have to go through medical underwriting, and they have the opportunity to give you the preferred rate, a higher rate, or say no thank you altogether. So the Medicare supplements are not guaranteed. They work on their own enrollment, which is any month out of the year you can apply for one, but you might have to answer the medical questions. Now, as far as enrollment periods are concerned, we have the annual enrollment period that happens each and every year, and unfortunately, it's become a real showcase for everybody who wants to advertise. So you see lots of TV commercials, get lots of mail, and probably way too many phone calls. The annual enrollment period runs from October 15 to December the 7th, and that's the time to make any changes in either Medicare Advantage plan or with your prescription drug plan. Any changes you make here will start in January and generally last for the entire year. If you have Medicare Advantage, however, you get one more opportunity to make a one-time change in the first quarter of the year. Let's say you tried a new Advantage plan but didn't like it and you wanted to switch back. You still have that opportunity during the first quarter. You have one chance to make a change, and then that will last with you for the rest of the year. There are special enrollment periods outside of that normal enrollment timeframe. If you have a special life event, like you retire, lose employer coverage, move from one area to the other. If you qualify for extra help or LIS, that also creates a special enrollment, and I'll talk about that in a few minutes as well. So those are some areas where you have some special enrollments, but typically you want to focus on this annual enrollment each and every year to review and make sure that your plan is remaining the way you want. If you don't want to make any changes, then you don't have to. Your current plan will roll into the next year with whatever changes that they're making for January the 1st. If you want to make a change, you have to actively do something to get out or to change the plan. So just a reminder there about enrollment periods. These next few slides I'm going to skip past and go on to prescription drug coverage. Now, it's important here to make a delineation between prescription cost and medical cost. In Medicare, prescription costs are always separate from medical cost. So they're divvied out separately, and there is no cap or limit on prescription costs in Medicare. So there are only these 4 different phases that determine how much you're going to be paying. So if you have a drug that applies to the deductible, and by the way, Medicare is the one that sets the deductible limits and the maximum out-of-pocket limits. I didn't say already, but on the Medicare Advantage plan, the plans do have a cap or a limit on your out-of-pocket spending. It's $7,550. And if you hit that number by the co-pays and the co-insurance that you've paid from your pocket, then the insurance company has to pick up the rest of the cost for the remainder of the year. Every January, of course, every plan resets, including the prescription plans, and those deductibles, of course, reset. The prescription plan deductible, again, can be no higher than $480. If your medicine applies to that prescription deductible, then you would pay 100% of the cost of that medicine until you got through the deductible. Once you're through the deductible, you'd start with your co-pays or co-insurance. And anything you've paid from your pocket, whether it's a deductible or a co-pay, as well as what the insurance company has paid. So those 3 things, if they add up to a total cost of $4,430, you fall into the coverage gap or donut hole. What happens there is the co-pays go away. Now you're going to be paying 25% for your prescription drug costs. Once your total out-of-pocket, or if your total out-of-pocket costs reach $7,050, you fall into what they call catastrophic phase and roughly pay about 5%. So the whole point to tell you this is that the cost of medicine in Medicare can vary from month to month, depending upon which of these phases of coverage you are in. If you're currently in Medicare and have a prescription plan, your explanation of benefits that you receive, either monthly, bi-monthly, or quarterly, will tell you which of these phases you are currently in and how far do you have to go before you reach the next phase. So do pay attention to that and take a look at it. Some other rules that typically apply to all prescription plans are these. The pharmacy network. Every insurance company contracts with certain pharmacies to get better co-pays and co-insurance, better prices, so they want you to use their pharmacy networks. You do want to make sure that you kind of match these things up as you're looking at or going into a new plan, because if you have to change something to keep your costs down, it's important to know what you have to do. Every plan, of course, has a list of medicines that are covered, or this formulary, as they call it, and you want to make sure that your medicines are included in the plan. All plans have at least 5 tiers, with the lowest tier being the preferred generics and the highest tier all the way up to the specialty drugs. They always want you to start with the lower tier, which is the cheaper medications, and work your way up if you have to. They call that step therapy. There are also limits on what you might be able to get for certain medications, things like opioids, pain management, controlled substances, may have limits on how much you can get for either a 30-day or a 90-day supply. Your doctor may have to authorize some medications, not all, but there are some that have this prior authorization requirement, meaning that they have to check off that you're taking that medication for the reason that it was FDA approved for. If you need a medication that's not on your formulary or list, maybe it's either not covered typically, or it might be one that's not covered on that list because you can't take the other ones that are there. Your doctor can work with the plan to see if they'll approve that one there for you. It's called a drug exception. This also applies if you need higher limits of certain medications as well. Let's say your drug is on a quantity limit, but you need more than that quantity. If your doctor can work with the plan to make that exception, then that will all be included there for you. Now, these are the rules about original Medicare only, with no additional assistance or special programs. These are the resources for those folks with Medicare. Medicare, of course, is open 24 hours a day. If you have questions, you just call the number that's on the back of your Medicare card. Or you can go to their website, medicare.gov. Social Security, only open Monday through Friday, 7 to 7. And the earlier you call these numbers or closer to off hours that you can get, the easier it might be to get through, because these are very busy programs and it may take sometimes hours to get through, especially in the fourth quarter of the year when they're very busy with enrollments. You might find that you wait for an extended period of time. So make sure that you pull out your patience when you dial that phone number and try to schedule it at a time when they might not be as busy, like first thing in the morning. Let's see, this is about all I have for Medicare. So what I'd like to do is to stop here and see if we have any questions in the chat that I might be able to answer before I move on to the more popular topic of Medicaid and Medicare.
Absolutely. So we got a few questions about intersections with Medicaid that we'll save. So keep in mind, if you sent those questions in, we'll get to them after we get to the next section. But one that seems to be only about Medicare was someone's asking if there are military exceptions to Part A and B charges in terms of deductibles, fees, those kinds of things.
So I would say the best advice I can give there is to contact Social Security. If you've been paying into the system, then they may already have you there and you may not have to pay as far as any charges are concerned. Or if you're talking specifically about deductibles for the plan for Medicare as services are concerned, then it would be up to Medicare if they work with TRICARE to help cover the cost of services. And so I'm not exactly sure if you're talking about cost of services or premiums.
They mentioned deductibles, but then said et cetera. So broad net there.
Yeah. So that would be up to TRICARE to talk to them about how they work with Medicare to cover the costs for those out-of-pocket service costs for services. And it would be a coordination of efforts between those two.
Okay. Thank you. So then we'll turn things back over to you to go to the Medicaid piece. And again, keep your questions coming as you have them. And then we'll do another big round of Q&A at the end where we see how these programs overlap.
Excellent. Thank you so much. So I'm going to go on to layering the next step, which is we already talked about Medicare. It's kind of the basis for the services. We add on Medicaid. Medicaid comes in and helps to cover costs for copays and out-of-pocket, as well as adding on some additional services for folks. Now, in the past, if you had Medicaid first and then become eligible for Medicare, those two things together, the Medicaid changes a little bit from non-Medicare to Medicare side of things. So typically what Virginia State would do is a redetermination of your Medicaid benefits. However, with the advent of COVID, they have been absolutely inundated with so many new requests, and the volume is too much for them to handle. So what they have done, because of all the additional folks that have either been sick, laid off, changes in income, and new applications coming in for Medicaid, if you're already on Medicaid and then become Medicare eligible, they put you into this category now called Medicaid Expansion. There's been some recent changes on this within the last month or so. We got notification that it's Medicaid Expansion is going to continue for an undetermined amount of time. They haven't decided when they're going to be able to do some of these redeterminations to put people into different buckets, if you will. In the past, they have had people in various different levels of being dual eligible and would classify them as QMB, or Qualified Medical Beneficiaries, QMB plus, SLMB, SLMB plus, et cetera, et cetera. So there's quite a few different ones. Now, sorry, I'm going back and forth here a little bit. I wanted to see if I had a little better list or chart of that, but I don't at the moment have anything more than those determinations. So there's about 7 different levels of Medicaid in the state of Virginia. And some of those levels then will allow you to go on to get these special needs plans. What I'd like to do is talk a little bit more, though, about the Medicaid before I go on to the special needs plans. And again, the classifications were QMB, QMB plus, SLMB, SLMB plus, and FBDE, or full benefit dual eligible. Folks that were in those categories were eligible for some extra programs. And so what it does is Medicare starts the benefit, Medicaid comes in and starts to help pay for the doctor visits and those kinds of things. But these dual eligible programs is a third layer that will also add additional benefits, maybe extra networks for doctors and providers, a variety of different things. Now, with Medicaid, if you had QMB plus, SLMB plus, FBDE, you were eligible for what's called an MCO, or a managed care organization. The managed care organizations include these: Aetna, Anthem, Molina, Optima, United Healthcare, et cetera. And you pick your MCO. The MCO is a private insurance company that basically administers the Medicaid benefit. And with that, you usually got a card that was called a CCC Plus, or Commonwealth Coordinated Care card. They don't give me an example of one of those, but they have the little C's in the corner and they're kind of turned around and make a circle. And it's called the Commonwealth Coordinated Care Plan, also sometimes called the Community Plan. And some folks in Medicaid only get the white card with the Virginia state icon and not the MCO card or the CCC Plus card. So you could have one or the other. And so it depends on your determination. I have found that there are many folks who had Medicaid before coming into Medicare, only have the white card, and they've been put into Medicaid Expansion, which is this new category that they're leaving folks into for some undetermined amount of time. Now, if you're eligible for Medicaid of any level, you should also be eligible for LIS, or extra help. The LIS program is administered through Social Security, and it helps in a variety of different ways. That extra help program can help to pay for a prescription plan or possibly a dual eligible plan. Sometimes there are monthly premiums, but those are paid for by the Extra Help program. So your cost is zero. It helps to lower the cost of prescriptions at the pharmacy. It creates a special enrollment period once per quarter in the first, second, and third quarters of the year. And of course, if you enroll in fourth quarter, it goes in with the annual enrollment and your changes take effect in January. It also takes away the requirement of a network for the pharmacy. So if you like to go to CVS or you want to go to Giant or some specialty pharmacy, you can go to any pharmacy you want. Under the Extra Help program, you have no pharmacy network. You can go anywhere you choose. So those are some things that the Extra Help program takes care of. And generally, Medicaid and Extra Help go hand in hand. If you, for some reason, didn't get enrolled in that, you should apply. Extra Help is administered again through Social Security. The income and asset limits are higher than they are for the requirement for Medicaid. So that's why most folks are eligible right away. If you have Medicaid benefits, you're automatically enrolled in the LIS or Extra Help program. Now, these extra programs called the dual SNP or dual special needs plans, let's talk more about who can join on one of those. There are several different kinds of special needs plans. The one that I'm going to talk about today, which is the more common in Northern Virginia, is the dual special need plan. Some of them, there are some that are called chronic special needs. You have to have certain conditions. We don't have as many of those in Northern Virginia, and they're generally enrolled, or the benefits are kind of rolled into the D-SNP or dual plans anyway. What you get with a dual special needs plan is you may get some additional provider networks, whether that's for doctors, hospitals. Your benefits are still covered at zero cost to you, so you're not losing Medicaid, layering onto Medicaid. So it's not a loss of something. You don't have to give up one to get the other. You'll also get some additional benefits, maybe some additional money for things like dental, vision, hearing aids, maybe some transportation in there that you didn't get with Medicaid, because now it takes you back and forth to the pharmacy or to the gym. You'll usually have a gym membership included in there, and you may have some additional coverage for prescriptions. One or two of the carriers have made a commitment to lower cost of prescriptions, even lower than the LIS or Extra Help program. So you may get some extra things there. Now, you do have to have your Medicaid card. And remember, it's certain levels of Medicaid that can apply for some of these extra plans. Again, it's SLMB plus, QMB plus, QMB, and FBDE. In addition, the newly eligible Medicaid expansion, there are some special programs for those folks now too. So the Medicaid of a certain level, your Medicare card, you have to live in the plan service area. And I'm going to say, no, you don't have to meet certain health requirements because we don't have very many chronic special needs plans. So that would only be for those plans. And again, what are the extra things that you get? You might have a provider network of more than just Medicaid that would allow you to see different specialists or doctors, some additional drug coverage, and those extra benefits like the dental services, credits to shop for over-the-counter products, things that you might need on a daily basis or on a routine basis, toothbrushes, toothpaste, mouthwash, vitamins, supplements, shower, a shower seat. They also have a variety of other personal care items that are in there, so that you can get credits for those things, and that can make a big difference in somebody's life. Rides to appointments, in addition to the ones that you get through Medicaid, some additional vision coverage, maybe a personal monitoring device, some additional online options for doctor visits, healthy food credits towards fresh fruit and vegetables, healthy pantry items and meat, and some additional drug coverage and more. So some of the extra things that these plans can give to you. Now, what you have to be very concerned about or very particular about, there's always a catch. So you want to make sure that you're looking before enrolling into one of these plans about your needs. Are your prescriptions covered in this plan under their formulary? What about the doctors that you currently see, or the clinics, or durable medical equipment, or home health care that you use? So make sure to take a look at all of those things. Now, I routinely do this for my clients, and I'll make a little plug here that agents can help you to do this. It's no cost to you to have someone help you. And I would recommend to find yourself somebody you feel comfortable with, somebody that you can talk to that can help you with the enrollment on these, because not only do I help my clients to plug in their medications, make sure they're covered, I check their providers, whatever that might be, if it's a hospital or some sort of durable medical equipment provider or whatever it is, we check to make sure those things are in the network, or if you have to change, who are you going to use? Those things are important to make sure that you're looking at. Most of these plans, the plans that give you higher levels of benefit, are HMO. You don't have to have referrals necessarily, but they do want you to stay inside the network. So if you go outside that network, you might be stuck with the bill because it's not covered by anyone else. Even if you have a PPO plan, you might find that you have to go to a provider in network. If you go to a provider that's outside the network, they file to the company or the carrier that you use, and then they have to file a second claim to get the rest of the bill paid through Medicaid. So they either have to be a Medicaid or an insurance company provider, one of those two. You can't just go to anybody that you want if you have a PPO plan. So some things to be able to watch out for there. And, just other providers that you're looking for, make a list of your priorities. What's most important to you? Is it doctors? Is it dental? Is it your medical equipment? What are the things that are most important to you to keep or to add on when you're looking at getting into an additional plan? So ask somebody to help you. Again, using an agent, it's no cost to you. We do a lot of continuing education each and every year to make sure that we know what the plans look like ahead of time. I just got notification today that our government-sponsored training, or AHIP, starts June the 20th. So it's right around the corner when it's time to start training again. And we have to go through certifications with each company that we are enrolled in as agents to sell. The resources that we have here are just the same resources that we looked at before with Medicare, Social Security. Of course, the low-income subsidy or extra help is available through Social Security, and this administration on aging. The state resources that you probably already have, you can always follow up with them. And, we'll go on to look at one more thing, and that is I'm going to give you my contact information and then go into see what questions we have. I do want to make mention down here, if you're not sure if you have an MCO or a managed care organization with your Medicaid, or if you're eligible, you can check that through this number, and they'll give you a status check and let you know what it is you're eligible for. So they kind of tell you what level of Medicaid you have or you're eligible to get into. It's a valuable service to know, and it's typically not on your award letter. So, the providers or the insurance companies are always asking, what is your status? It's hard to tell because they don't tell you, but you can call and check and see what you're eligible for. Okay. let me go ahead and look at the questions.
So the first one we got is about someone who's 37 years old, has Medicare. Their Part B of Medicare is provided through Aetna. The person also has Medicaid through their CCC Plus waiver, so is a current dual eligible. But on top of that, they have Blue Cross Blue Shield insurance through their parents' work with the federal government. So the question is, does Blue Cross Blue Shield even play a role anymore at this point where we've got these two other insurances working together? And if so, how?
So yes, it actually can play a role, because that Blue Cross Blue Shield plan would allow you to go to any provider under their network, and you can get coverage for services there that might not be available under your current plan with CCC Plus and Medicare. So yes, it can be valuable. What you need to look at, I guess, really, to decide if you want to keep it or not, is to see how many of those bills are being paid by the Blue Cross Blue Shield Federal and not paid by the other two insurances or coverages. Does that make sense?
That's great. Thank you. And so the next one we got, and this you touched on briefly about having been in the country less than 5 years, but we've got someone who has 2 children on the autism spectrum who just came to the country. And so they're navigating all these health insurances things for the first time. And when they applied for Medicaid online, they got denied. So can you speak to why that may be?
Typically, Medicaid, you have to be in the country for 5 years to be eligible for Medicaid. However, you might want to talk to somebody about that, because usually the kids are eligible for Medicaid, not those 18 years or over. If you're more than 18, then generally you have to have been in the US for 5 years to be eligible for Medicaid. The kids usually are eligible right away for Medicaid. It may be more of a income and asset based at that point. So you may try to reach out to Medicaid and talk to them more about their requirement. Depends on, again, income, assets, a variety of different things. And if they are your dependents, which it sounds like they're young, so they probably still are, then you may not be able to get them on that Medicaid, get under a Medicaid waiver right away.
All right. We had another question, actually 2 from folks who joined us from Maryland, wondering if the dual special needs options are valid in Maryland as well.
Yes, there are dual special needs options in Maryland. They're different than they are in Virginia. So each Department of Insurance controls what's available in the state. And what we have available, for example, in Northern Virginia is a little different than what you might have in Richmond or Roanoke, different areas and counties. So each area is a little different. I'm happy to talk to you about plans in Maryland. I am licensed in 9 states. Maryland is one of them. They do have some dual eligible plans there. And if you have availability to get into one of those, then yes, you can certainly enroll in a dual plan. They won't look exactly the same as the Virginia plans, though.
That's great news. And the next question, I think you answered actually after this person chatted it in, but certainly worth reiterating. How do you find out what level of Medicaid do you have? And we're on a great slide for it.
That's a really good question. And it's a hard one too, because like I said, your award letter doesn't tell you what level of Medicaid you have. So you have to try to find out either through the Medicaid system directly, if you work with a case manager or somebody who has access to that system that might be able to help you out or tell you what level you have. It's not well known, and I don't know why they don't publish that or put it on your Medicaid card. But in Virginia, it's kind of a mystery where you fall unless you can get a hold of the right person at Medicaid. Now, that said, I have a system that I can look at through my broker portal. I plug in the person's information, their Medicaid card, number, their Medicare number, and basic demographic information like zip code, name, birth date. And it will tell me if you're eligible for some of these additional plans. It might not tell me the level of Medicaid, but it will tell me your eligibility and which plans you're eligible to come into. So that's a good thing. I don't have to know exactly which level you have, but it will tell me by just cross-referencing with the Virginia state system database. It'll tell me, yes or no for which plans.
Great. Our next one was, we have an adult child who's receiving full Medicaid benefits. And later this year, mom is going to retire and start drawing Social Security for mom. And they understand that 24 months after that happens, their daughter will become eligible for Medicare. So the question there is it a good idea to enroll when she becomes eligible? And will she have more benefits choices under just Medicare or as a dual eligible in that special population?
Okay, that's a multifaceted question there.
I can.
So the thing, if she doesn't enroll right away, where would she go? I guess that is the question. If you have an option for, say, your spouse who still could keep her on their employer-based plan, then fine. But if not, she would not want to go on an individual plan if she's eligible for Medicare, because you're going to get yourself into a situation where you might have a late enrollment penalty later on by coming back to enroll into the Medicare system after having been eligible. So once you're first eligible, yes, it's probably best to enroll. I'm happy to talk to you offline on that one, but most probably best to enroll right away. If she's eligible for some of these extra plans with Medicaid, Medicare, then absolutely, take a look at those and see if those extra benefits are something that would benefit both her and you.
Yeah, and our experience for the families on is that most often, once that child's parents retire, pass away, become disabled, they start receiving SSDI, Social Security benefits, because of their parents' change. It's essentially automatic that 24 months later, your Medicare card comes in the mail. So often not even a choice. Right. So that'll take care of part of it. The next question here is, if an individual becomes ineligible for the Medicaid they were getting because of their waiver, as their work income rises, right? So Medicare and Medicaid waiver had booted them out because their income is too high. Could they still receive just regular Medicaid if SSDI is their only income?
So they're not eligible for Medicare at this point. Is that correct?
That's what it seems like, yes. And if they would, I guess they could still be a dual special needs person if they were. But this intersection of work and benefits with the waiver is something we see a lot. Okay.
And I don't know that I can answer that question necessarily. If they're not eligible for the disability waiver because the Social Security income and their work on income is too high, then they wouldn't be eligible for Medicaid at all. But if they're on the SSDI, then they would be eligible for Medicare in that 24-month period. And yes, you would enroll in a Medicare-based plan at that time.
And often Medicaid, unless you enroll in a special work incentives programs that are done through Social Security, not through Medicaid, it's very difficult if your income exceeds waiver cap to be under the regular Medicaid cap. The regular Medicaid cap is lower unless through Social Security you've enrolled in one of these questions. So I'm happy to put a link in the chat to our free benefits counselors in Virginia who work on Social Security benefits and this side. And I would tackle it with Social Security versus with Medicaid. And their work is free, but it's through the Independence Center. The link is in the chat. And for folks watching later, it's Independence spelled END, like ending dependence, independence.org/services/benefits-counseling, or you can Google free benefits counseling Virginia, and they have the contract to do that. The next question is, are there services available to the Virginia Medicaid cardholder in Maryland if for some reason or another that person has a provider they want in Maryland?
Generally, no. If you are Medicaid eligible, your services come from Virginia. They don't like to cover other states because Virginia is where your benefit comes from. So typically, no, unless you have, a plan that has a dual eligible plan, for example, that has a provider network that allows you to go out of state into a neighboring state.
Really rare that we see someone, for example, if they have an incredibly unusual need and there's only a specialist out of state or all Virginia specialists to turn them down, you can get a special permission, but that takes a lot of time and effort. I think you're exactly right. Difficult to do. We've got a 20-year-old dual eligible who's not having any copays for Medicare because Medicaid's paying for them.
Mm-hmm.
He's not receiving SSI benefits through Social Security and doesn't have a waiver. He does work part-time, is earning income through working part-time more than $2,000 a month, ultimately going to cancel his eligibility for the Medicaid and Medicare. And this may be another one where it's better to talk to that Social Security work incentives coordinator.
I think it is. I would defer that one over to them. Now, with that said, I will say that if they're still eligible to be in the Medicare system, but not eligible for Medicaid, I would still look or consider this Social Security program of extra help. Their income and asset limits are higher than Medicaid, not by leaps and bounds, but they are a little bit higher. So you still might be able to be eligible for extra help, even though you're not eligible for Medicaid. So don't give up on both programs. Do still look at the extra help program.
All right, we've got a 26-year-old on the autism spectrum who has Medicaid because they have a CCC plus waiver and receives SSI. This adult's dad started receiving his Social Security benefits last year. So like we've talked about, there's that 2-year, that 24-month delay before this person will get Medicare. The question is, when they get that Medicare, a quick confirmation of, is there a monthly premium to have it since this person has Medicaid already?
Typically, Medicaid would pay for that. So the premiums would be paid for by Medicaid.
All right. Are resource limits different for dual eligible beneficiaries who fall under the different categories, FBDB versus Medicaid expansion, what have you, those kinds of things? Does that change? Does your level of Medicaid change your resource limit?
Your resource limit
for like income and assets?
Yeah, so it may be that it's more based on situations, I believe, more than it is income and assets. And that might be also a question to defer to your Social Security folks who might have more input or information about what classifications each of those folks would be in.
All right, we had a question of clarification here. If an adult has a CCC plus plan, they have a Medicaid waiver and are enrolled in that Medicaid managed care, does this mean they automatically have a dual special needs plan too?
You do not automatically have a dual special needs plan. You have to enroll into one of those. So you may be automatically enrolled in Medicare, but it does not mean that you're going to be enrolled in that third level of dual special needs plans. You have to do that on your own. And there's a variety of things that kind of come into play there. Again, looking at what's available to you, provider networks, prescription drugs, and all those kinds of things to make sure that that's what you want. So there is no auto enrollment into any plan.
Right. So you've got to have that Medicaid, that Medicare, and then still enroll in that dual special needs plan. There's nothing automatic about it. Okay. I'm going to go over, some people I think put questions in the chat too. In our remaining minutes, we'll try and get to some of those. Okay. Someone is kind of generally confused about who would be eligible for Medicare versus Medicaid, thinking about their adult son with a developmental disability, who's usually getting insurance through his dad's retirement plan Should he be looking out for Medicaid and Medicare options too?
It sounds like if he is a disabled individual that he should be considering that SSDI benefit that would start that whole process into place.
Yeah, so, and we would certainly encourage folks to apply for Medicaid and the Medicare automatically. Okay, just scrolling through questions real quick because there are a lot here, and some of which you answered because they were put in both places. Okay, and we've got a 32-year-old who has one of the developmental disability waivers, so then definitely has Medicaid and also has Medicare. If he starts to have income, he'll have to spend down to stay eligible. So that's a Medicaid term, meaning each month he'll have to show he's spending a certain amount of income on qualified medical expenses, and we're not counting that as income as a result. And so it's kind of a question about what does that spend down mean? So I see that you put in there, he has one of the developmental disability waivers. The only Medicaid waiver in Virginia that has that spend down option is the CCC Plus waiver. And Virginia gave the same name to our managed care plans, CCC Plus managed care, as they did to a waiver, which is admittedly really confusing. So if your loved one has a CCC Plus waiver and then Medicaid managed care through that, they can spend down each month. And that means they'll submit documentation each month saying some of the money I got as income, I spent on qualifying disability expenses, orthotics, extra therapies that weren't covered. If the person has a DD waiver, the DD waiver does not have a spend down provision and will not allow people to do that. We worked really hard with the legislator to try and push that through in Virginia. And I think that there's hope for that in the future, but right now there is not a spend down option with the DD waiver. Yeah, so we got the question again about, is this a service for folks in Maryland? And yes, you were very clear in saying yes, folks in Maryland can get dual special needs plans, and there's free benefits counseling if you're a Social Security recipient in Maryland too. Just like I mentioned, the Independence Center does it in Northern Virginia or throughout Virginia. There's a group called Independence Now, Independence spelled the usual way, innow.org in Maryland that also does that free benefits counseling. Okay. And I think that that's all for today and right on time. So how about that? Thank you so much, Lisa, for joining us and for sharing your contact information here. We'll get the recording and slides sent out to folks. And we certainly would love to hear your thoughts on having Lisa come back in the future, because as she talked about, things are often shifting and what the true answers are today may be very different a year from now. Thank you all so much for joining us, and we'll reach out to people who join live later on email. And if you're watching this later, already calls to have you back. And already, if you're watching this later, you can go to the arcofnova.org/answers and put a question into our portal if you need a copy of the slides or other questions answered, and we can help you find Lisa too. Thanks everybody, and have a great day.